exactly is this diabetic diet?
So that's the most difficult question to answer. For a diabetic diet, the first important thing is that is the diabetic diet is the one which is served in the hospital.
Are actually foods not allowed in diabetes?
Everybody's mind is that what are the sugar-free foods? There is no sugar-free foods. Oh, now I cannot eat any of my favorite. So that's a wrong impression.
So what are the common myths related to diabetic diet which you have seen and which everyone
Anywhere you search for diabetic, they will say that carbohydrate is the reason for diabetes.
someone who is newly identified with diabetes, what are the tips which you would like to give them so that they should not only control the diabetes now?
And the sugar means it is sugar. It's not honey or jaggery or gold or any type of other sugar, or the organic sugar or the palm sugar are safe. All sugar is sugar.
Important question which you already mentioned about carbohydrate. How important is it? Namaste everyone. Welcome to yet another episode of podcast with me, Dr. Amitabh Kulkarni, wherein we identify a topic of common interest, try to understand it from the expert and share some knowledge. Diabetes. Diabetes is one of the commonest disease all over the world, whether it is Middle East or other parts of the world. And everyone, almost everyone, whether you are a doctor, whether you are a patient or whether you are a relative of the patient, you need to understand about diabetes. Today I'm very happy Dr. Fiji, who is an expert dietitian or nutritionist, she's going to explain about that, is with us to share some knowledge about diabetes related diet. Dr. Fiji is a renowned dietitian with more than 20 years of experience in the field. She is going to clear some doubts about diabetic diet, give us some extra tips about how to maintain diabetes through diet, and share some more information related to that. So, Dr. Fiji, I'm very happy. Welcome to the podcast. Thank you for accepting the invitation and to be with us today. So, Dr. Fiji, you have been expert in this field for more than 20 years. So, can you just tell us something about your background, your training, how long you've been in this field?
Thank you, Dr. Amitabh, for the wonderful opportunity, because I never miss any chance to talk about the right nutrition to the public. And moreover, now it's very important to know that who is the right dietitian. Yeah. So in UAE, we have two licensed, clinical dietitian and the nutritionist. Okay. Both the criteria is different. Okay. So if you have a degree in clinical dietetics, you become a clinical dietitian. And if it is public health, nutrition, such type of topic, then it is a nutritionist license.
Understood.
So I'm a clinical dietitian from 2004 license onwards. Wow. And then my educational background, first of all, I'm a postgraduate in food and nutrition, and later on doctorate in food and nutrition in the year 2005. Expertise, if you want me to call or say that, then you can become only with another expertise specialized field. So that which I have done it with the European Society of Clinical Nutrition, the European Diploma, the ISPEN Diploma, which is in 2016. Lately, one small certificate course I did with the Harvard Public Health as well. Wow. So, but if you ask me about the dietetic knowledge and what is the right diet or how we should educate the public, it is personalized, it is individualized, and it should be tailor-made.
So we are we are very lucky today with we have a dietitian who is going to tell us she has an extensive experience in the field, and definitely everyone is going to get benefited through this podcast today. So Dr. Fiji, let us start with the discussion. Now the commonest the label is diabetic diet. Okay, so someone who has diabetes, we tell them eat diabetic diet. Many of the doctors advise same thing. So what exactly is this diabetic diet? Is it actually friendly with the patient or with the relatives? What exactly is diabetic diet?
For a diabetic diet, the first important thing is that is the diabetic diet is the one which is served in the hospital, or is it a diabetic diet which we counsel for a patient in the consultation room? Okay. So if it is a consultation room, like a personalized diet, that is completely different than the diabetic diet which is served in the hospital. Okay. The hospital, it will be catering to 200 patients. Right. So it will be in the fixed carbohydrate and calories and all those details. Understood. And it will be almost with the regional cuisines. Now, it's not that it is individualized. Right. Like for example, I need dosa, but may not be dosa in the menu, but there is idli in the menu.
Yeah,
So
yeah.
it's almost the same.
Yeah,
So that's the difference between individualized and the catering menu. So diabetic menu in the hospital, it will be, as I said, fixed schedule, fixed protocol. But of course, there won't be any sugar,
correct,
like the direct sugar.
correct.
In a personalized diet, we make it a little bit more convenient and comfortable for the patient because it's going to be in the long run.
Yeah.
And it should be comfortable for not only for the patient, for the relatives, for who are taking care of the food, and it should adjust with their budget in the grocery.
Yeah.
So we cannot talk about anything which doesn't fit in their budget as well. And if it is a home with the 12 people, 12 diets cannot be prepared by a homemaker.
True.
So the diabetic diet is, of course, it is sugar free, no doubt about it. And the calorie restriction, how you take it with the carbohydrate. So the basic difference is the carbohydrate and the sugar in a diabetic diet.
Right. So then, from your understanding or your discussion, diabetic diet which is served in hospital, is it different from someone who is preparing at home? I can understand you may not be able to personalize the diet in hospital considering so many patients, but is it still good enough to maintain or control the diabetes when someone is already admitted in the hospital
Exactly.
or under treatment?
Exactly. That's the main purpose. So the first goal of nutrition care in a hospital setting is to control the sugar.
Correct.
Otherwise, in the next ward rounds, the doctors will ask why the sugar is high.
Exactly.
So we have to explain.
Yeah.
So of course, the calorie restriction and the carbohydrate count is fixed in a hospital setting. It will varies from 180 to 220 carbohydrate per day. But in home, we will personalize in such a way that if the HbA1c is getting controlled, we always give them the freedom to eat everything under the sun. But if the HbA1c is under control.
Understood. Now, I'm sure you have seen all sorts of patients, relatives, even doctors. So what are the common myths related to diabetic diet which you have seen and which everyone, like including me as a doctor, should be aware about it? I'm sure you have come across many.
Yeah, the first and foremost funny questions we receive in the OPD consultation. OPD means the patient comes for a direct consultation and for the individualized diet. The most difficult task is that if the doctors or the so-called Google doctors will say that don't eat carbohydrate for a diabetic patient.
Okay.
So that's the most difficult question to answer and to convince the patient, because anywhere you search for diabetic, they will say that carbohydrate is the reason for diabetes. But without carbohydrate, no meal is complete. And even if you're diabetic, even if your HbA1c is 13, you should have carbohydrate. But there is a portion control, there is an exchange control, and there is a definite way to control the sugar levels to avoid the hyperglycemia. So it's not about controlling or removing the carbohydrate itself is the main agenda of a diabetic diet. It needs to be balanced with all other nutrients, including the proteins and fat and fiber and all other macronutrients which is required for a human body.
So viewers, please understand, don't remove carbohydrates from the food. It is just the percentage, or it should be in the appropriate amount so that the correct nutrients have reached your body. Now, coming to the next important question which you already mentioned about carbohydrate, how important is it in control of carbohydrate in managing the diabetes? How important it is?
Carbohydrate is the main ingredient or the nutrient which we know about when you are a diabetic patient or when your relative is a diabetic patient. So when you are cooking food for a diabetic patient, when you are doing the grocery for a diabetic patient, the first and foremost thing is that avoid all the direct sugar. So when I say direct sugar, there is no organic honey or organic brown sugar or palm sugar is favorite for a diabetic patient. It needs to be avoided completely till the HbA1c comes below 6. So that's the first target for anybody who is taking care of the diabetes. Now coming back to the carbohydrate exclusively, there are two types of carbohydrate. One is simple and the other one is complex. So a diabetic patient should completely avoid till the HbA1c get into control the simple carbohydrate. So simple carbohydrate is away in their diet till the HbA1c is controlled. Away. I'm not saying that avoid, away. So then the complex carbohydrate, which is mostly contained in all the whole grains, whole pulses, multigrains, fibers from the vegetables, they are all the complex carbohydrate. They have to be included in the meal as much as possible and keep the simple sugars or simple carbohydrate away in the meal.
Yeah, so listeners, please understand you don't have to stop it completely, as Dr. Fiji said, that maybe simple carbohydrates you should not be taking in initial period until your sugar comes under control. But the complex carbohydrates are not as bad as portrayed, and you can still continue to take some complex carbohydrate as Dr. mentioned. Now, coming to the next question, in addition to carbohydrate, we have proteins in the diet, fat in the diet. So what role do they play in control of? Do they play any role in the control of diabetes? Like sometimes we say, don't eat fat or fatty food. Obviously, it's going to increase the insulin resistance, which may be difficult for sugar control. What role do proteins and fat play? They should be also controlled, reduced. What should be done with that?
Okay, it's a very good question. Thank you for that, Dr. Amda, because there is a lot of, again, the Google or the search engines, they always promote for the high protein diet and high fat diet, and I'm not naming, there are a lot of diets in the web series. So the most important factor about the balanced nutrition is that there should be a complete important role for specific portion control for the carbohydrate, protein and fat. Of course, the vegetable is the most ingredient and the most important ingredient for any diet who are controlling the weight, who are on the pre-diabetic condition, who are on the diabetic condition, who are on the uncontrolled diabetic condition, or who are maintaining the diabetic condition. So anyways, all these nutrients plays a vital role and there should be a specific portion control for each ingredient. Now coming back to the quantity and the quality of the fat and the protein, the most important thing a dietitian does in their desk when they individualize a diet plan is that how much we can give or how much calorie you are taking from the fats and the proteins. Accordingly, the carbohydrate exchange also will affect it. But all in a short while, if a take home message, if I want to say, I would say that protein is a must, but not exclusive. Good fat is a must and there should be a certain quantity of fat is required for your human body, but avoid the trans fatty acids, saturated fatty acids, simple language, the fried food, the fatty food, cheesy, creamy, fatty food, avoid as much as possible. So don't have a bread butter jam for your breakfast.
Thank you, Dr. Fiji, for clarifying. Viewers, please understand everything. We are re-emphasizing everything in balanced amount should be consumed and it is necessary for our body, as Dr. Fiji is. Now coming to another commonly asked question, me as a doctor, or I'm sure you also must be facing this question. Fruits are actually fruits not allowed in diabetes, or if yes, what fruits should be taken? Are they really bad for diabetes, or any specific food is bad for diabetes? So what is the role of fruits? Like should patient be stopping fruit or consuming fruit?
Okay, that's another very important question and one of the most important concern for a diabetic patient when they come to know that they are newly diagnosed diabetes. And when we started talking, I'm a dietitian, then the first question they will say that, oh, now I cannot eat any of my favorite food. So that's a wrong impression that they can eat all the good food, but they should get into a range of good control of diabetes. So coming back to the fruits, anybody who love to have fruits, they should have fruits. There are two criteria very important with respect to the fruits. One is do not have juices. Even if it is a fresh squeezed juice or fresh blended juice at home, do not initiate the juice custom or the culture when you are initiating the diabetic control in your home or in your place. So that's one thing. So juice is not preferred over the fruit. So the fruit is preferred over the juice. That's one thing. Second thing, if your sugar levels are controlled, I'm talking about the HbA1c less than 6, you are allowed to have 3 to 4 fruits a day. But if you are a newly diagnosed diabetes with HbA1c 8, 10, 1 fruit a day. Now, which fruit you should have? If you are in a control of the carbohydrate and the portions in a total daily plan, you are allowed to have 2 or 3 fruits, depends upon the glycemic index of the fruits. Now, the question everybody's mind is that what are the sugar-free fruits? There is no sugar-free fruits. There is no theory that fruits are safe also. But the fruits are having the glycemic index which is favorable for having when your sugar levels are in the uncontrolled stage, when you're taking the medication and insulin. So the fruits which is controlled or good enough during that time are apple, orange, pear, kiwi, and also pomegranate. This is the most easiest way of remembering that these are the food which will not give you any harm.
So viewers, please understand, you can eat fruits but in moderate amount as explained by Dr. Fiji. Now coming to another important question about fruits. This is mango season. Almost all patients ask us whether we should eat mango because we have been told not to eat mango. So what is your advice, yes or no to them?
Yeah, first of all, I would like to say yes.
Yeah, thank you.
You should enjoy.
That will relieve many of our patients. Yeah.
You should enjoy the seasonal fruits, but in definite portions and control.
Right.
And it is the same like if you have a birthday, are you going to eat a piece of cake?
Correct.
So
Correct.
it's the same way. If you are doing a puja, are you going to do the are you going to have the prasadam little bit? So you should have, but you should enjoy it in a definite portions and control.
Thank you for clarifying. I am sure many viewers are relieved with this answer. Coming to the next question, the meal timings, because there is so many discussion about this, what time we should eat, what time we should not be eating, what portion we should be consuming. So what is your suggestion? Should there be any fixed meal timing or a fixed portion or any other advice for them?
For the diabetic diet, whether you are pre-diabetic, whether you are uncontrolled, and you are maintaining your diabetic, of course they should have a portion control. Now it is again personalized, so I'm not going into the personalized way. It is because it is different for me and Dr. Amitabh.
Correct.
So that needs to get individualized, and that's what the dietitian does. How much a person should have a portion of carbohydrate or fat or protein or vegetable according to their weight, height, sex, activity. So that's one thing. And of course their clinical condition with respect to the lab results. Now coming back to the quantities, how you are going to portion control yourself and how you schedule your day.
Okay.
So when we do the diet consultation, the first thing I always tell the patient is that even if you have a best diet plan, if you don't have a schedule, you're
Right.
going to fail it. So that is why when you don't get a result for a certain period of time, the most important part is that you don't have a consistent, comfortable schedule
Right.
to fix the diet. And there comes the time of the meal. So a person who is doing night duty, morning duty, and holiday, the regular schedule which most of the Gulfians have. So they have a different schedule for a
Right.
morning duty, evening duty, and also night duty,
Right.
and also another day when they are off at home. So that's different.
Yeah.
Now coming back to a fixed schedule of a 9 to 6 schedule of office work. For a person, if they are not stuck in traffic for more than 1 hour, they are out of home before 8 o'clock. So their breakfast is before 8 o'clock.
Right.
Now the person who is working at 11 o'clock, coming home at 11 o'clock, they may get up at only at 7 o'clock.
Right.
So they may have breakfast only at 8 o'clock or 9 o'clock to leave home at around 9:30. So the schedule differs.
Right.
So a person who is coming back home at 11 o'clock, I cannot say that you should not eat food after 7, before
Right.
7.
Right.
Because they should have the home prepared, warm, nice, tasty food. And they should have it at home, not from a grocery or a cafeteria or a restaurant, or
Understood.
compromise the food completely that no dinner at all.
Yeah.
So it depends upon your schedule, it depends upon how you are going to manage your daily activity. That's very important, but the summary is that you should have all meals.
Yes. So this is very important message from today's discussion. You should have all the meals. Don't skip meals just because you have diabetes or you are worried about increasing sugar. Now everyone may have a different schedule for the work, but you should still try to find the timings to have meals. As Dr. Fiji explained clearly, the portion is very important. So a controlled portion in your case as suggested by your physician or dietitian should be followed. Thank you Dr. Fiji for this another interesting answer for commonly asked question. Now I'm going to ask you another interesting question. Now so many fancy diets are in discussion all over YouTube, all over social media. Intermittent fasting, keto diet, this diet, that diet, and some of them also claim that they reverse diabetes, they control diabetes, they cure diabetes. As a layman, what should I understand from that, and whether I should really follow whether that intermittent fasting at the age of 40 or 50 or 30? Is it good for me or not? What is your suggestion about these fancy diets?
Of course, the diets which is there in the search engines are not evidence based,
Yeah.
and if they are evidence based, so there are diets which they claim that they are evidence based as well.
Right.
So you have to go and see that what base of studies they have done it.
Right.
That's a
Right.
different story, and again the clinicians only can
Yeah.
value that one.
Yeah.
But the most important thing for a common man is that what basis you are following that diet. Is it for a quick fix? No. Is it for your long lasting problem? And the clinician itself is advising you that it's better that since your day schedule is fixing like that, you may avoid one meal because some salads and the fruits will be more than enough. You don't need any protein in the dinner. These all things can be done, but it depends upon lots of other criteria. Your lab results, your physical fitness, your body composition. Now the body composition is something which we do in the personalized diet plan. Depends upon the body's muscle composition. We can suggest whether you need to take how much protein, and if the protein is not required so much, you may skip one protein. The same way, you have to compromise on the energy deficit. Then only you can lose weight. Then only you can control your diabetes.
Right.
So there comes the total calorie composition which you have to do. So the diets are made of lots of other theories, lots of other influences and impacts, but they are not wrong. I will not say they are wrong because they are all in practice. But we don't know the side effects. What will happen after that? So if a person is skipping the meal for a long time and developing gastric ulcers, what is the benefit? You may reduce your weight, but you're developing another disease condition.
Viewers, don't blindly follow a diet, a fancy diet which may have benefited your friend or relative, may not be beneficial for you. So always take a consultation from the concerned authority before actually going for such diet. Coming to next question, Dr. Fiji. Now, someone who is newly identified with diabetes, what are the 3 or 4 tips which you would like to give them so that they should not only control the diabetes now, deal with it and avoid its complications in future?
First of all, when you diagnose diabetes, how you diagnose diabetes? Only the clinician should diagnose your diabetes, not any GMT test. You went to your friend's house, you did the GMTs, the sugar is high. So don't worry or don't get panic that you are diabetic. You have to meet a physician and do concerned test results. Then only the clinician will diagnose you that you are diabetic or not. And in that one, I was talking always about HbA1c.
Right.
So the HbA1c is the glycosylated hemoglobin level, which is the average of 3 months glucose level. So yesterday I did fasting and today I did fasting in the sense that you didn't have food for more than 12 hours. And then you check your fasting sugar and it is normal. So don't assume that your sugar level is normal.
Correct.
You have to get the HbA1c control, you have to get your PPBS control, you have to see the insulin resistance is normal. So there are lots of ways in which the diabetes gets controlled. Point number 1. Point number 2, what you should do when you realize that, oh, I am pre-diabetic, I am going to get diabetic very soon, my weight is gaining, so I have a history of diabetes in my family, I may get diabetic. The first and foremost thing is that avoid sugar. There is no simple other tip to give other than avoiding the sugar. And the sugar means it is sugar. It's not honey or jaggery or good or any type of other sugar, or the organic sugar or the palm sugar are safe. All sugar is sugar.
Correct.
There comes the question again that whether the sweetener to be replaced. Yes, you can replace sweetener, but not completely scientifically supporting the practice of having the aspartame and sucralose, because the excess usage always result in other form of clinical problems, especially weight. So what we always advise is that if you can avoid the sugar for some time, that's the best thing. Now, coming back to the second tip, what you have to do is that check your schedule. Are you eating food normal? What is normal means? Normal means balanced nutrition. What is balanced nutrition? There should be a protein, there should be a vegetable, there should be a carbohydrate. So this is the balance of nutrition which you have to accomplish all throughout the day. And check whether your bowel movement is regular. Are you developing gastritis? Yes, then there is a problem. Are you drinking a lot of tea and coffee? There is a problem. Are you drinking soft drinks, alcohol, juices? There is a problem. So these are the checklists which you have to do first when you diagnose your diabetes, and sleep well.
Thank you very much, Dr. Fiji, for this friendly advice for newly diagnosed diabetes. Now, as a family member of a diabetes, what will be your advice to the family members when they are dealing with someone who has a diabetes, whether it is controlled or newly diagnosed or uncontrolled diabetes? So, what is your advice to the relatives or family members?
Okay, the first foremost is the budget.
Yeah.
Yeah. So the most important thing is don't change everything to sweetener or low calorie or sugar free and low fat. Don't do that one initially unless and until it is required and clinicians have advised you first. Second, you all have to eat together at least one meal, and the patient also should feel that I'm a part of the family and I'm eating the normal food.
Right.
And do not cook separate food for the patient. We all should eat the same food, only the portion should change. Now, coming back to the portion, the best and the easiest way to plan a diet for a diabetic patient is the plate method.
Right.
The plate method is the most scientific and most well-known and most practical, comfortably, consistently patients are following. So it's very simple. Take your plate, the dining plate, and make it into half, and the half should be vegetable. Simple. Now, what vegetable? Non-starchy vegetable. It includes all the vegetables other than potato and corn. Very simple. Now, coming back to the other half. The other half you divide it into two, and one half should be carbohydrate, one half should be protein. What is the protein? It can be lentils and kidney beans as a vegetarian, or it can be egg, or it can be chicken or fish or meat according to the non-vegetarian. Now the other portion, which is the carbohydrate, you can mix and match. Either it is a whole grain, multigrain, millets, rice, chapati, potatoes, corn. So that is the carbohydrate portion. This needs to be your plate, but the cooking, the cuisine, the dishes, it should be the same as family.
So yeah, thank you very much for this advice. So viewers, please don't isolate the diabetic member from your family, and try to share as much meal with him as possible, as advised by Dr. Fiji. Now, coming to another interesting question, which we also as a doctor face many a times. Many of the patients ask me, one of their friend reversed diabetes with the diet only, they did not take medicine. So what is your take on this? Can diabetes be really reversed with only diet, or it's just a short-term phenomena, it may come back again? So many a times patients are hesitant to start medicine, and they prefer to continue with diet for long period, irrespective of their physician's advice. In your experience, what do you suggest? Can diet just reverse diabetes completely?
I don't like the term reverse, first of all.
Yeah.
It's just my individual perspective about diabetes. I always believe in live well with diabetes.
Right.
You maintain your diabetes, control your sugar, lead a normal life. So that is better than this reversal of diabetes. What is the difference? If you just convince a patient that you can reverse diabetes, they will stop everything when they see the HbA1c 5.7, which is wrong. They have to check the HbA1c again in every 6 months. Every 1 year, they have to consult the doctors. Now, the question whether have I seen that? Yes, I have seen that. I have seen the patients, they are out of the medications for a long time. They are having the HbA1c less than 6 for so many years. But it depends upon the person. The patients are having a beautiful lifestyle, maintaining a consistent schedule in their life. Their portion controls are always almost the same. They enjoy all the food. When they have the HbA1c less than 6, they enjoy all the food. But they do have a lifestyle with a regular exercise, regular diet, regular lifestyle. They don't indulge in any habits which can be harmful for the diabetes. Thus, we prevent the prognosis of diabetic complications.
Yeah.
And that's what we should aim at. Not the reversal term, but live well with the diabetes.
Yeah. So viewers, please understand, diabetes or the elevated sugars may reduce for short time with diet alone. But as Dr. Fiji correctly said, you should try to live with diabetes. You should accept you have diabetes or elevated sugar, and try to align your lifestyle along with the diabetes, so that even in future 10 years 20 years down the line, you won't have to face any complications related to diabetes. Dr. Fiji, this brings us to the end of this wonderful discussion. I think we can discuss on this topic for hours together. Thank you very much for the insightful discussion, the important tips. Please understand, diet, it can be a slow poison if you are not following it properly. So as our Dr. Fiji has correctly mentioned that you have to control the portion, you have to control the timings, you have to control what fruits you are eating, what proteins you are eating, what fat you are eating. Controlling diabetes with diet is just going to help you in preventing its long-term complications, whether it is related to heart, whether it is related to kidney, brain, or any other organs. So viewers, please understand, diet plays a very important role in control of diabetes. Try to live with diabetes, accept that you have diabetes, and try to modify your diet as advised by Dr. Fiji. Remember that this is just an advice. Advice needs to be personalized. So don't take this advice in total. You should always consult your dietitian or physician and personalize your diet as per your preferences, as per your sugar levels, as per your height and weight. So this will be the take home message from us. Thank you very much, viewers. Thank you very much, Dr. Fiji, for coming and sharing this important knowledge.
Thank you
very
sir.
much.
Thank you.
Thank you.